welcome to the Sex and Wellness Podcast with Dr. Mary. Today, we're really excited because we're in my new space, so you're not seeing our little curtain that I had before if you're watching the video. But today, we're going to be talking about PCOS. And today, I'm here with Dr. Stephanie Chan. She is a pharmacist and also a women's health coach. So she's going to give us some different strategies and tips on understanding PCOS. And if you're not sure what it is, or if it's something you're concerned that you may have it, we will talk about that today. So thank you so much.
Thank you for having me. I'm really excited to be here. And I do love the new space.
Thank you. Yeah, these chairs, I just thought it'd be more fun to kind of be cozy and chat about stuff. So thank you for coming today.
Thank you. Yeah, thanks for having me.
Yeah, so fill us in. So if you want to go ahead and just explain what PCOS is. I know some people call it PCOS as well. So
essentially PCOS is short for Polycystic Ovarian Syndrome. And across the board, I guess the doctors kind of diagnosed it based off of the Rotterdam criteria. So essentially there's three things that kind of characterize it. There's one of them is going to be a missing period or irregular cycle. A lot of times what that looks like and what doctors are looking for is if you're having less than like 10 cycles in a month. The second thing,
in a year?
In a year,
okay.
I'm sorry. Yes.
I was like, in a month? Oh my gosh, 10 cycles?
10 cycles in a year.
Okay.
They might find high androgen levels, so things like testosterone or DHEAS. The last one is going to be an ultrasound that can find cysts on your ovaries. So you just have to have 2 out of those 3 items, and you could technically be diagnosed with PCOS. So I think that's where it gets really tricky, where getting a proper diagnosis in the beginning, in the get-go from a doctor is really important to make sure that like treatment is appropriate as well.
Yeah, I mean, and then the other aspect of that too is which part of that leads to the insulin resistance.
Yeah. So a lot of times I like to think of like insulin resistance as one of the drivers of PCOS. Everyone is going to have different drivers. So insulin resistance is really going to be driving the piece that is going to give you the delayed ovulation or the irregular cycles. That's also going to lead to weight gain. So technically, insulin resistance on a blood test is not one of the diagnosing criteria, if that makes sense.
Yeah, I think it's interesting because it's a tricky thing to diagnose. Yeah. Because somebody could get their A1C, so that's something that tests blood sugar over the past 3 months, and it may look normal, right? And so can you explain what insulin resistance is then?
Yeah, so insulin is a hormone that essentially whenever we eat an apple or anything with carbohydrates, insulin is going to be that key that helps our cells unlock the cell so that the sugar can go in and our cells use it. What happens over time, like in diabetes, is we have developed this thing called insulin resistance where that key doesn't work anymore. So we're unable to unlock those doors, and therefore blood sugar is going to keep running around in the body and not being used properly. So that's when we face issues like the weight gain and like not being able to ovulate, and more for example, in diabetes, we'll have things like nerve damage and such too.
Okay. And so kind of adding on to that, I know that patients that I've seen or even friends that I have that are not sure if they have PCOS or they're not even aware of it. We talked about certain body types that you tend to kind of hold your weight in your abdomen and have smaller or thinner legs and a bigger belly, bigger midsection. And so why would you say that happens?
Yeah, so again, I think that comes down to the insulin resistance. Yeah. That's a hallmark presentation or picture of PCOS because of the excess weight gain around the belly. One thing I like to mention is that I like to remind women who do have PCOS is that it's not their fault. One thing that I see, and one thing I hear a lot from women is that they're telling me that, like, their weight is just coming on with no explanation. They're not doing any changes in their diet. And when they go to the doctors are just telling them, well, just eat less and exercise more.
Which
Right.
makes me so angry.
Yeah.
Because as somebody that, I mean, I was on steroids for a while during
Yeah.
chemotherapy, and you just, like, it can be medically induced weight gain.
Yeah.
It can be these different symptoms. And so it's so ignorant to tell
Yes.
somebody to eat less and exercise more. And we'll talk about in a bit, that almost can exacerbate
Yes.
some of the symptoms, especially if you're dealing with chronic stress. And so it's not, oh, this person is in a heavier body, like they need to lose weight.
Right.
It's like, that's not true at all. We have to look at, well, what's the underlying medical condition that could be causing them
Right.
not to lose weight, right?
Exactly. And there's never ever a conversation.
No,
That-
never.
there's
I mean,
never-
rarely.
yeah,
but
yeah. Never a conversation that discusses, like, what they're currently eating, you know?
Yeah.
If they asked a little bit more, the patient would probably be already telling you, you know, I have a smoothie for breakfast, I'll have a salad for lunch, and then I'll eat, you know, I'll have some soup before dinner.
Mm-hmm.
And, you know, I heard on the internet to not eat after 6, so I don't eat before bed again. So, you know, these women are already eating
Yeah.
maybe 1,200 calories a day, and for a doctor to just tell them
Eat
based
less.
off of,
Yeah.
you know, how they look, like, just eat less. It's frustrating, and no wonder women kind of give up, or like,
Oh, yeah.
don't know, you know, or they go to the internet and they're searching and Googling and trying to all these different supplements to see, like, which way to go then.
But I also think, too, is that we're talking about people that have been diagnosed. There's so many people that are
Yes.
undiagnosed,
Yeah.
right? Because the way that it's conventionally treated is birth control. And so
Yeah.
we're going to talk about some different options for
Yes.
that. And that's why I'm so excited to have you on, because it's like, okay, it's multifactorial. Like, women in general in the United States, especially that grew up in the 90s, right?
Yeah.
With the Victoria's Secret era and this like
Yes.
body image stuff. We're dealing with a lot of body image issues already even in
yep.
people that have bodies that look normal compared to society's quote standards, right?
Yes.
I'm quoting
Yeah.
normal because there is no normal, right?
Uh-huh.
But so then add on that aspect, and then, like you said, it's not your fault. Like, then they start blaming themselves. Well, if my doctor thinks that, you know, I'm fat because it's my fault, or I'm gaining this
Right.
weight because it's my fault, then it probably is. And so we already have that, you know, based on our cultural norms. So it's just like compounding
Yeah.
on all of this stuff.
Yeah. And it's unfortunate that women, just like going to the doctor's office, they're afraid of, you know, like, they almost go in knowing what their doctor would say to them
Yeah.
as the solution. Like, they already know, like, well, do I need to even go to the doctor? They're just going to tell me it's my weight issue, to lose some weight, and that would fix everything. So
I just went to, I was talking to you about this earlier, but I just went to a cancer retreat. It's Kairos retreat. So at this retreat, it was all young cancer survivors that are anywhere from like 25, or it's anywhere from like 18 to late 40s. And so we're talking about a lot of the things that our doctors have told us, or our healthcare practitioners have told us, and it is astronomical. Like, some of the people that are in bigger bodies were saying how, hey, my doctor told me my cancer would go away if I just lost weight. Like, thank you. It was heartbreaking.
yeah. Like,
Heartbreaking. And so if that was the case, then every person in a bigger body would have cancer.
Right.
So let's talk about that,
Yeah.
right? It's
That
such a
makes
cop-out.
sense. You're right.
It's such a cop-out. And so then it perpetuates
Yeah.
this cycle of shame and guilt and
Yeah.
blame,
Like,
right?
it's their fault that they're sick.
Exactly. Oh, yeah.
Yeah.
That's basically like, you're just saying, oh, you know, because you're fat,
Yeah.
you have cancer. And
Right.
it's like, well, that doesn't, I mean, when I was diagnosed with cancer, I was like pretty like at regular weight. I was
Mhm.
drinking like turmeric smoothies every morning. I was exercising multiple times a week.
Right.
Like, it was the picture of health on the outside.
Right.
But, you know, that's still not, you know, I still got it. So if we just kind of, I talked about medical gaslighting with Dr. Allie Day in our previous podcast, and this is just something, it's just kind of feeding into it, right? Because how many times have your patients been told these things?
Yep. All the time. I on a daily basis when I'm talking to these women, that this is like the feedback that I get, which is why we're in the space doing what we're doing.
I'm so passionate about it, because I'm like, let's just like wipe clean the bullshit. Like, I will call it. I'm so tired of just like censoring myself. I'm so tired of censoring myself, because it's just like, okay, we've seen enough of this,
Sure.
especially in women, right? And so, and then so the more we can talk about it and the more resources we can give people, the better.
100%.
So talk to me a little bit about what are some non-birth control options that are available for PCOS?
So in like the conventional medicine world?
I want to know, not just because conventional medicine world, it's what, metformin and like birth control, right?
Yeah.
Okay, so that doesn't address the cause.
Yeah.
So what would be what would you suggest from your side of what you've experienced as a, in
my space of health coach? Yeah. So for me, when I'm working with women, you can't talk about PCOS and healing from PCOS without talking about the nutrition side of things.
Yeah.
That's always step number one. And I think that we need to switch our conversation about nutrition as well for women, because we always think that like we need to eat little portions of like salads and greens and stuff. But one of the major things that I've seen make a huge impact for women, especially for PCOS, is getting enough protein.
Oh yeah. Huge.
Yeah. Like I promise you, anyone listening to this, if you actually go through your day and track your protein for a day, I can bet you that it's averaging around like 50 grams.
Oh, yeah.
For the average person, right, who's not tracking.
Oh, yeah.
But try to double that, start doubling that, and notice a huge shift in, like, your energy and just your overall health, your satiety throughout the day, getting protein throughout, like, first thing in the morning. Women, please stop intermittent fasting, especially if you have PCOS and you're trying, and, you're still at an age of, like, reproductive, like, you're trying to conceive, and during that time, like, intermittent fasting is just not the answer for you. It can be beneficial in certain times, but again, we've talked about how most of the women who are struggling with chronic health issues already have their buckets overflowing. Intermittent fasting is one of those things that kind of stresses the body out. That's why it's so like beneficial. Essentially, it works because it's a stressor on the body. But for the women who are already overflowing, their stress buckets are already flowing, it's not ideal for them. So I always recommend getting enough protein throughout the day and consistently throughout the day. Blood sugar management is going to be huge. So one of the easiest ways is to make sure you're eating every 3 to 4 hours. By the time women, they're so go and busy, they could probably go a whole morning. They look up and it's been like 6 or 7 hours since they last ate. That amount of time causes a dip in our blood sugar, so hypoglycemic, right? And that actually kickstart our body's own stress response. So even without eating, I like to remind women, even without eating during that time, that doesn't mean your blood sugar levels stay flatline. Like, our bodies are very smart. It has a protective mechanism. So if you're not feeding it, it's going to find sugar from somewhere else. And that's usually like your liver or your muscle storage. And it's a very expensive process, and it's a stressor on the body that we want to avoid.
It's crazy because I've dealt with some insulin resistance myself. I don't have PCOS, but I do have history of endometriosis, which is another podcast. Yeah. But it's interesting because I think people don't understand nutrition. And even in like physical therapy school, we didn't talk about it. Like, there is, and maybe the newer programs are talking about it, but it is a huge component. Recently, I started tracking what I'm eating, because I felt I felt my chronic fatigue flaring up like crazy. And I was like, okay, what is going on? And I realized I started tracking. So I used MyFitnessPal to kind of type in what I was eating to see what my macros were. So macros are going to basically, they're macronutrients. So basically you're going to look at your carbs, fiber, fat, protein, right? And so for me, when if I'm eating a ton of carbs, especially like white bread or pizza and things
all the
like
good
that.
stuff.
It's fine if I do it once, but it's like if you stay on that, right? The fatigue was just getting to be pretty debilitating. And then I have to reel myself back and be like, okay, what's going on in my diet? My protein was so minimal. And so it's interesting because that's what I try to tell people too, is like, well, they're like, I'm not eating much. I just ate oatmeal for breakfast. And I'm like, oh my gosh, well, like if you don't have a protein with that, your blood sugar is going to go up and then spike and crash. You'll be hungry like 2 hours later.
Exactly.
And so adding a protein in that can be anything from, you could put
hard-boiled eggs.
A scoop of protein maybe in the oatmeal.
Yeah, in the oatmeal. Very easy way to bump up protein content.
Yeah, and you stay fuller longer. It's crazy because it's like, I remember before I knew this, I was like, why am I like so hungry at 10, right? I'd eat at 8. I like famished, like had to run to eat food immediately. And so now it's a big difference. And so it's like, okay, you might be like eating the 90s way. When I say 90s, I'm talking about like the low fat, not eating, like working out like crazy. Your body's cortisol is increasing. So I think people don't understand why they're gaining weight because they're not putting food in. So can you talk about how cortisol, what cortisol is in its response to the body when we're not eating and exercising too much?
Yeah. So cortisol is our stress response. And one of the jobs of one of the effects or the downstream effects of cortisol is creating sugar. So cortisol is something that our body, it's our fight and flight mode. So if we're getting attacked by a bear or like if, there's any type of stressor, our body is going to respond the exact same way. So whether we're, in an argument with our spouse or we had a really hard exercise workout from like a group fitness class, our body responds the same way. And that's by creating cortisol. So one of the downstream effects of that is releasing and finding glucose because we need that glucose essentially to tell our bodies to get to a place of safety to run, right? So glucose essentially, gives the body more energy. But over time, when women are chronically stressed out, that cortisol just like keeps telling our body to pump out glucose, but we're not doing anything with it, right? And that glucose is signaling our body to increase insulin because anytime there's a rise in glucose, it's going to tell our bodies to release insulin so that we could use that glucose again for energy. So chronically, when we have this flux of cortisol, it's telling our body to increase insulin, and then that's how we could be having high sugar levels throughout the day without eating the carbohydrates.
Well, that's why it's like a holistic approach, right? It's like you can eat all these things and do everything right? Like you can eat, your protein and all these different things, but if you're chronically stressed, right? You're chronically running around with your head cut off every day, and then on top, even if you're not doing that and you're dealing with internal stressors like depression, like anxiety, all these different factors, right? So pulling yourself back into kind of being like, okay, this has to be a whole life approach, not just one small piece of it. It's a whole thing, right?
Yeah. Oh, 100%.
Because you can eat. I know that, I've had it where I was eating well, but I kept gaining weight in my belly. But it was because I was so stressed out about my eating disorder, about like not gaining weight, that then it was like this cycle of, okay, well, why do I still have this belly fat, right? Why am I holding weight here? And it's a component too that it's just the day-to-day stressors that we're dealing with. And as women, we don't need to do it all. We can ask for help. And so
I think I want to touch upon that because you I feel like you're very in tune with your body when it
took a long time.
Right. Yeah, that's what
Yeah.
I'm saying. And it takes a long time, and not that many women, at least ones that I come across with, have, really have a moment to sit down with themselves and ask themselves like where the stressors are coming in their life. And when they're able to do that, like that's a tip too. If you have a moment to really sit down and have really be honest with yourself, like eating in front of the TV, or are you eating in front of social media, which already makes you feel bad about yourself?
Yeah.
Right? Are you eating on the go because you have to run around and take your kids to school or drop them off, or you're running late to work? Those are all factors that affect how you're processing and breaking down and absorbing your food. So it can be a really tough conversation to have sometimes, and even for myself, I have to be honest with myself. Like, it's hard to like just turn the phone down and have a meal by yourself.
Yes.
But it can make such a big difference. I know you just had some like energy healing this weekend as well. It really does make a difference.
Well, and here's the thing, like, I'm not gonna lie, like, there are days where, like, the other day I was driving and I was running late, so I like threw my breakfast in the car. I had yogurt in a bowl, which is like, I don't recommend for anybody to do that, but like, I was like, okay, I'm just gonna eat this. I hit a curb on, like, I would like turn too quickly and I hit a curb that the yogurt flew up in the air and like fell all over my seat, and I was like, this is what I get for trying to rush my meals. But the point is that there's gonna be meals that you're eating on the go, right? It's more of what are you doing constantly, right? It's not stopping stress 24/7. It's letting your body process stress and coming down out of it. It is because there's going to be stressors. Like, there are things externally that we cannot control, right? Like, something could happen. Maybe this AC goes out in my house. Like, I can't control that. I'm going to be stressed out, and then I'm going to bring myself back down. And so it's even just kind of pulling yourself back into your body to kind of feel that. And I don't know if people even know that is possible. I mean, I was forced to do it because I got cancer. And so, but because I was like, I don't want this to happen again. And so how can I touch on everything? Because I was doing the exercise and nutrition part, but I wasn't doing the emotional healing part, right? And like, I was talking so negatively to myself day in and day out, and unmanaged anxiety, and kind of digging deeper. And that's when therapy can come in, right? I'm in group therapy right now, but different aspects of therapy and all these different things, because there's going to be stressors. Like, there's financial stressors if you're a single mom, if you're a single parent, or you're single in general and one income household and you have a stressful job, right? So it's like, okay, how can you work in those moments? Like, even I'll say to people, like, even if it's just, if you have a bunch of kids that are trying to, like, you need a break and just like sit on the toilet for an extra 5 minutes. And then my friends and their moms are like, that, I can't even do that. Like, they come in with that. I'm like, okay, well, somewhere where you can hide for 5 minutes and just be, because I'll feel myself. Like, just last week I had a flare up of anxiety, and I was like, okay, I need to sit with this because it's making me run around with my head cut off like a chicken. And that's how I used to live. And I was like, okay, I need to get out of this because I'm getting irritated at people. I'm honking more on the road. I'm just like, okay, what is that? Right? So how can I bring myself down? Because I don't want people to think, well, I have all this stuff like going on. I'm like, yes, I know it's hard. And I'm not going to say it's not. It's just even just planting that seed in your brain of, okay, how can I adjust this? Like, how can I make this, okay, well, I know a stressful event's coming up. How can I support myself around that? If I have a support system, how can I lean on them during that time? Because we've kind of almost taught ourselves to just be like, I'm good, right? Like, I'll take it all. And then we have all these health issues because we're doing so much and not asking for help. Right?
But people don't put that, like, 2 and 2 together. They think that it's completely 2 separate things.
I never did either. That's why I'm like, we have to be talking about this.
Right.
Like, if somebody's coming in chronic pelvic pain or chronic symptoms or all these things, it's like, okay, we're not having these conversations, right? How are we you're missing like this whole component as well.
Yeah.
And that's just like scratching the surface.
Yeah.
Right? And so, anyways, that was my little tangent.
I know. We could probably go on all day about that topic.
Yeah. But yeah, it's important.
Yeah.
And so adding in more protein. What do you think about continuous glucose monitors?
I think it's really cool.
I think that's cool.
Yeah, I think it's really cool if you have the budget for it. Because, I mean, I think if you do fall into that diabetic range, some insurance companies will provide you with one. But now there's a handful of companies out there that you could buy one without like diabetes or insurance or anything like that. And I think it's just another set of information that you can use. Like for me, I love looking at the data and the numbers and like crunching it. And, for some people, they'll see that a banana, does not affect their blood sugar at all. But for somebody else who might have some food sensitivity to it, that they do see like a huge spike in their sugar. So I think it's really good data. Is it a must-need tool for PCOS? I wouldn't start there. I would start with everything else, dealing with the stress, eating more well-balanced, adding more protein, and eating more consistently throughout the day. And then if that is not working, then I would use that as like a next stool, as a tool for the next step.
Yeah, you said stool, but I talk about stool too. We can talk about stools.
Absolutely. Oh, and on that note, stool, I don't know how this reminded me of the thyroid, but hypothyroid is very common when it comes to PCOS. I want to say like 25% of women with hypothyroidism is also going to have some sort of PCOS. So if you're going to see your doctor for PCOS symptoms, just please make sure they're checking your thyroid as well. It goes undiagnosed a lot in women just because they're not getting a full thyroid panel. So if you're just going for an annual, most doctors are just going to test you for your TSH, which is your thyroid stimulating hormone. It's only one of the markers of your thyroid health. If you go, I definitely recommend asking your doctor for a full thyroid panel. So looking at your thyroid antibodies, your T4, your T3, those are all the ones that would give you more information of how your thyroid's actually doing.
Yeah, no, I think that's great for people to know.
Yeah.
And so diet, exercise. Well, let's talk about exercise.
Yes.
And so, I see people like they're doing a ton of cardio, pushing themselves to this extreme. I mean, like, why am I not losing weight? So what type of exercise program would you recommend for somebody with PCOS?
Nice and slow and resistance training. So get off the cardio machines unless it's raining out and you just want to go for a walk on the treadmill, and if you can't be outside. But Austin, for the most part, we have such beautiful weather here. Just
except from June to July.
Yeah.
Through August.
Yeah, I know. Take walks. Walks are great, and focusing on strength training. You don't have to do any sort of like burpees or like, I don't want to call, different group workout classes out or anything like that. But like Orange Theory, those like HIIT classes probably are not my go-to choice for PCOS, because again, it just keeps filling that stress bucket that most women have that's already overfilling. So I would focusing on, doing squatting, deadlifting, or just using weights. You start with your body weight if you need a place to start, or bands. Bands are so cheap, and you could do them in your garage or backyard and just use them that way and start there. That not only do we see like mental health in that sense benefits, but also for the insulin resistance. That's going to be the best form of exercise.
Well, even just like with the Orange series, I feel like I like the idea of it, but it's just like you can go and maybe use the treadmill.
Yeah.
But it's like you don't have to do your max heart rate, right?
Yes.
And so like if it's something that maybe that's the only access to the gym that they have
Yeah.
on there. It's like, okay, how can you modify some of this? So
Yeah.
maybe you don't go into is it the red zone? Is the higher one?
Yeah.
Maybe you kind of just go through the movements of it versus
Yeah,
like
that's
pushing
smart.
yourself. But it's also hard to not push yourself when they're
you're
saying to
surrounded.
push yourself.
Right.
Because so it's more of, that and being like, okay, how can I just get a workout? And you don't have to be completely exhausted. I think as an ex-athlete, well, I guess I'm still an athlete, but like, you have this mentality that if you didn't work out, you're not, if you're not like about to die at the end, like you're not working out.
Right.
I have found for me, my body, like when I need to manage my blood sugar walking, I mean, even just like I just got one of those flat little treadmill things that you can slide under your desk or like your couch, because like we were saying, like there are certain days, like it was pouring down rain yesterday. Right. So it's like, oh, that's great for me to do. I'm like just watching TV or just kind of listening to music or whatever. Or maybe you're walking after a meal just for 20 minutes. And I never thought walking could make that much of an impact until I saw it directly affect how I felt. Yeah. So I'm always trying to get extra steps because it's like, oh, there's a direct correlation with how I feel and just light movement.
100%. And I know for me, with my history of like disordered eating, like I kind of took the step count too far. It was always
it's a gauge.
Yeah, it's a gauge. But I think that it's a great, for the people who are already sedentary, it's a great way to just start. Yeah,
just kind of go. Yeah, because I have body dysmorphia, and so like I've struggled with eating disorder as well. And so for me, I can't hyper focus on it. If I do, then it's re-triggering for me. So it's more of like, okay, let me just kind of be aware of it and start moving. Because then it's a whole other aspect that can flare things up and cause more stressors. But it's just think about things that are just, maybe you take the stairs instead of the elevator. Yes. Maybe you park your car a little bit further. Like these are little things that you can start implementing like right now. Right. And just kind of going from there.
Yeah. That's a great point, because I like to remind women that this is something that, like, stop waiting for, January 1st to be like, I'm going to jump on this elaborate, perfect exercise program that, you see on social media. Yeah. It's like, you don't need that. Yeah. You don't need that to heal from or to, like, start your health journey. So all the tips that you mentioned.
I get so annoyed at the ab picture. Like, follow my eating program. And I'm like, okay, first of all, you're 25 years old. Yeah. Like, I was talking to somebody else the other day, and I say that because it's like, when you're 25, it's just like, it's so much. You can eat anything. I was talking to somebody the other day, they were like, losing weight when you're 25 is just like one big fart. And I'm like, or one big poop. And I was like, I mean, it's not untrue. Right. So it's like, if you're not losing weight and you're going on these programs, like, it's not that there's something wrong with you. It's that we're not looking at it from a whole perspective. And, to get these rock hard fit abs, it's like, to even get to that point, it's almost an eating disorder because it's restrictive eating. Yeah. And so it's like, when I've had abs, I know how much I was restricting. And I was like, 100%. Oh my gosh. And I was like, okay. And I remember thinking, man, I'd rather just have the extra 10 pounds and be happier than just like, because nobody cared. Like, I mean, I'm not walking around in a bikini all day. Exactly. But I mean, that drives me bonkers. That and then like the bounce back after having your baby. Yeah. Very toxic. And so we are in a very diet culture world where it's like, oh, lose weight, hide your cellulite, get Botox, get this, get that. And it's like, do what you want to do, but ask yourself why you're doing it, right? Do it for you, not from an aspect of like, okay, society's going to view me different this way versus like sometimes if people want to do Botox, like, okay, like if it makes you feel better, but these expectations of women, and there are certain dermatology companies, even in Austin, that really perpetuate this with the billboards and all this stuff. And I'm like, oh my gosh, we're really still there in 2023, but it's a moneymaker. It's a multi-billion dollar industry. feeding off insecurities.
And I don't know if you want to go there, but if we want to touch upon like the whole new class of weight loss medications.
Oh,
yeah.
There. Yeah.
And I do, I do want to kind of pull it back to like, do I see its place in PCOS?
So yes, let's do that. Can you explain why there would be because I don't know if people know how Ozempic could affect PCOS. Yeah. So go ahead.
Ozempic, Wegovy, Mounjaro. There's a new one now called like Zepbound, I believe, which is the same protein but under a different name because now Zepbound finally got the FDA approval as obesity. So same drug and everything, just a different name. Essentially, it can help with PCOS because it's going to help with the weight loss part of it, the insulin resistance. It's going to help improve that aspect of it. However, a lot of times when I'm working with PCOS or women with PCOS, they're looking to conceive, right? And this whole class of medication, it's not studied in pregnancy yet. And because it's such a long-acting drug, I always recommend at least 3 months of being off of the medication completely before you even try to conceive, because the half-life and remnants of the medication could still be in the body after using it. So do I recommend it for somebody with PCOS? I think that it's so tricky with this class of medications because we have seen such tremendous results. I want to say that if it's able to help kickstart your good habits and you think that it is the thing that you personally need to finally kickstart and live a healthier lifestyle because you're seeing results right off the bat, then so be it. But do I recommend it for is it a cure for PCOS? No.
Yeah, it's a multifactorial thing. Sometimes people might need it to help stabilize their blood sugar, kind of kickstart their journey, right? But is it something that you go to right away?
Yeah.
It's like we've talked about before with antidepressants. Antidepressants in and of themselves can be a wonderful thing.
Yeah.
But is it the first line of defense? No.
Right.
Why are we just jumping? You're immediately depressed.
Yeah.
It's why are we not digging deeper and looking at the underlying stuff and addressing those things, right? And then then adding on the medication, which can then jumpstart that, right? And so it's your first line of defense. I don't know why I'm saying defense, but more of, I think it can be a great thing, but in U.S. culture, I feel like we rely so much on pharmaceuticals that it can be a great thing, but if it's used in the right way. I know that it has been overused for people to get extra skinny, and it's just is that a good thing too? And even some of the people that I know that have been using Ozempic, they find that it actually helps them find their appetite. So then they actually are focusing on other aspects of their life to fill that time instead of eating. That's what I've talked. Some people have said that to me, and they're like, so because the concern is what happens when I get off.
Yeah.
Do I want to be on this forever?
Yeah. And that group of people who are on it as well, the doctors are making a lot of money writing these prescriptions out for people. And there's I think we're in this space because a lot of women are not being coached. They're kind of left high and dry after they're done with the medication. There's no... who do they go? Yeah, who do they go to afterwards, right? They're only going to their doctor for the medication, but then what if, they tell them they're ready to stop?
Exactly. And then you're saying, the conceiving part.
Yeah.
So can we kind of talk a little bit on, so say somebody has PCOS and they're wanting to have a child, immediately I see people with PCOS just going straight into IVF.
Yes.
And I know that I just wish that more people had more education. Obviously, IVF is a great tool.
Yeah.
But should we jump to it immediately?
Yeah.
I have so much stuff on that. I mean, I did IVF for genetic reasons. I was a carrier for a disease. And so that's different, right?
Right.
But to actually have a child and conceive without jumping right to IVF, and that's a whole other podcast.
Yes.
But IVF can be great, but what can they do leading up to that to help their fertility?
Yeah, absolutely. So first off, if you have PCOS and you're trying to conceive, it is not impossible. The piece that makes the thing that makes it so difficult to get pregnant in women with PCOS is the ovulation piece. And the ovulation it's hard to ovulate because of that insulin resistance and inflammation piece. So everything that we've discussed, you could be working on those things and your body would be like, oh, I could totally ovulate on my own. There's no like need for IVF. Whereas IVF, there are some other steps, some things like using letrozole or Clomid, which helps your body induce ovulation in PCOS that you can always try prior to IVF. But yeah, I don't know that many women that have $30,000 just laying around for IVF, and it's not, guaranteed. One thing that I always like to remind women is that it's great to get pregnant, but your goal is not just to get pregnant. It's to have a healthy and successful pregnancy. For women with PCOS, if you just go straight to IVF and your eggs are not, you're not nurturing the body and like growing healthy eggs to begin with, you're just not, it's not fair. It's not a fair chance for you to have a healthy egg and a healthy pregnancy.
I think people don't understand that part too.
Yeah.
Because, what is it like? If you, like today, like the eggs you're making today are for 3 months out, right? And so if you start these changes today, you can start developing those, those eggs that are better quality and stuff. And I think people don't think that because they're just like, oh, the medication's going to do it.
Right,
yeah,
exactly.
And it's like, well, wait a second. There's that aspect as well. And then also the sperm aspect, which is another story. But like, we don't even look at that part when we're talking about the PCOS aspect. But yeah, exactly. And so making sure we're kind of looking at all these things. And so just for somebody that's listening and they want to start this today, how can they, like, you like data, I like data, and I feel like I like to know how I'm progressing. So what is something that they can look at? Like, should they start tracking like their periods and like kind of be like, okay, what is it that they can do right now that they can start tracking so they can get an idea of, is it working?
Yes. Start by tracking your cycle, number one, and then for signs of ovulation. So I know a lot of women with PCOS will use those like ovulation predictor
strips.
Those strips. Sometimes it may not be accurate for PCOS, but really great data to see a pattern within your own body, because outside of just using those test strips, other signs of ovulation would be like clear white or egg white cervical mucus is one, and then the positioning of your cervix, which can be a little bit challenging, or just using like your basal body temperature as another way of tracking.
We have it with all of our Apple Watches and
checking your temperature. And what we ideally want to see is that after ovulation or after predicted ovulation is that we'll see a rise in your temperature, which confirms that you did ovulate. So
perfect. So that egg, because I think people get confused too with discharge, because there's like discharge that can kind of look like white and like it's in your undies, but like when it's like that, like kind of
egg white.
Yeah, it's like egg white where
like snot.
Yes, perfect. It looks like snot, and so tracking your period, and that can make a big difference because I think like your period comes and then you can get an idea of it. And so I think that's awesome.
And for women with PCOS, I know that the complaint is it's irregular or I haven't had it for 3 months, right? But the whole point of tracking is that we'll start seeing patterns. You'll start seeing, even if you don't ovulate the next 30 days, you'll start noticing that like around day 12, right, your body is starting to produce, some more clear cervical mucus. Like you're showing those signs regularly at the same time every month. Even though you're not ovulating, you know that you're working in the right direction.
Perfect.
And so your body will ovulate.
I think that's amazing. This is so much great stuff that people can work on today.
Yeah.
So is there anything else that we didn't talk about that you feel is a big thing we should be addressing or talking about with PCOS?
No, not off the top of my head. I just like to remind people that it's definitely possible to manage on your own, and that if you go to the doctor for PCOS and they're just sending you home with like birth control or metformin, just do the research a little bit yourself, or reach out to myself for another healthcare provider who will talk it through with you, because there are definitely way more options out there than birth control or metformin that you could be doing today.
Yeah. And like we were saying before with Ozempic and things like that, is like the metformin can be helpful, but it's just, it's like the first thing to give somebody. And it's like, well, why don't we look at what's happening in their bodies and what they're eating, because there's so much that people can change immediately.
100%.
And so how can people reach you? I know you want to explain the program that you have.
So I do have a program where I work one-on-one with women trying to conceive with PCOS. So inside the program, all the signs of like the tips with tracking ovulation, we go through all that. We focus on specific nutrients and supplements that you might need. I like to think of everyone is very unique, and I don't like a one size
fits all.
Fits all approach. So without we gave really great general information today, but in order to really help move the needle, sometimes I like to do a specific personalized approach.
I mean, there's like in my practice too, there's like a general stuff. There's general things that people can work on today. But if it's, it's sometimes it's something you need somebody to come work with you, right? And you're well educated, healthcare professional as well. You're not somebody on the internet saying you're like a fertility coach. Like you have excessive education. You're a doctor of pharmacy. And so thank you so much for coming.
Thank you.
And then we'll link
much.
all your info, your Insta, and then your program.
My Instagram is Steph Chan RX, and then the program and stuff, I'll send you the link.
Perfect. Thank you so much.
Thank you.
All right, we'll see you guys in 2 weeks.